Staying safe through coronavirus, I'm Elliot Weiler. We know these are uncertain times, which is why we're joining you this afternoon with this Facebook Live. We hope it is conversation that is filled with facts and useful information. And hopefully at the end, you'll get a better sense of how to handle this challenging shared situation that we are all in together. Speaking of getting through this together, this is the third week that those of us that work at Consumer Reports are working from home. So we would ask some forgiveness if there are internet connectivity issues along the way. A lot of people using some bandwidth today. You also might hear a barking dog. I'm talking specifically about my dog that might be barking. You might hear a child. So bear with us. This is relatively new for us, but we do hope it will be useful and helpful for you. One other bit of housekeeping before we begin today. This Facebook Live event is for informational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. As always, seek the advice of your physician or other qualified medical or health provider with any specific questions you have regarding coronavirus or any other medical condition. Now, we're very, very fortunate to have two very special guests with us today, both from Consumer Reports, Lauren Friedman and Jim Rogers. Lauren is Deputy Health Editor with Consumer Reports. She's been reporting on science and health issues for more than 12 years, and she is coordinating all of our coronavirus coverage. You can imagine she has been exceedingly busy over the past few weeks. Lauren, thanks for all you've done. Thanks for being here. Jim Rogers is Consumer Reports Director of Food Testing, Safety, and Research. Jim holds advanced degrees in microbiology and immunology, and before joining Consumer Reports, he held various positions at the United States Department of Agriculture's Food Safety and Inspection Service. Jim, you've been very useful as well throughout our coverage. We appreciate you being here as well this afternoon. We're going to start with talking safety inside of our homes. We are all spending more time inside, as we should be, based on the advice of elected officials and public health authorities. We also might be eating more food inside. I feel like I am eating 3 meals a day, if not more, snacking, all of it inside my house. We want to be safe about all of that. So let's talk about safety first inside. And Lauren, we'll begin with you. This idea of cleaning, I think we have all gone through probably more cleaning than we have done maybe ever in our lives, all of it to be safe. Talk generally about those surfaces that we should pay special attention to, and then how we can actually kill the coronavirus in our cleaning processes.
Sure. Thanks, Elliot. So to start out, the first thing to keep in mind when you're thinking about keeping your home clean is that just make it a habit that the first thing you should do when you walk in your door is to wash your hands, because think about kind of all the things you could be bringing in from outside. So that's going to be an important first step. And cleaning is especially important if someone in your house is sick. But even if they're not, it's just a good idea to be wiping down what they call high touch surfaces. So those are things like doorknobs, countertops, literally just the things that people touch a lot all day long in your home. And there are a lot of kind of common cleaning products that will do fine on these surfaces. A bleach solution, an alcohol solution, hydrogen peroxide. Don't mix these things, by the way, but any of these things can help clean up, along with a lot of the disinfectants that are a little bit harder to find now.
And for some of these things, we should be thinking of doing them perhaps as much as a daily basis or several times a day, depending on how many people are in the house and where those high-touch surfaces are.
You don't want to make yourself crazy, but especially if someone in your home is sick, you do want to be cleaning those surfaces at least once a day, the CDC says.
Great. Okay. And we certainly want to invite questions throughout our Facebook Live event. We're talking about staying safe with coronavirus. Lauren Friedman, Jim Rogers from Consumer Reports joining us. We do have one question that was submitted beforehand here, and I'll be asking a few of these throughout our programs today for people that did ask some questions. And this is a good one. And Lauren, we'll just stick with you since you were talking about wipes and cleaning. The question is sort of the idea of whether or not you need to have an antibacterial or disinfecting wipe. Could something also be labeled as antiviral? So why don't you go through and maybe clear up some of the label confusion and specifically what we should be looking for when we're shopping in stores for wipes and cleaners?
Sure. So it's important to remember the coronavirus. I mean, it's in the name, but it's a virus. So any antibacterial products are not going to have any special power over it because it's a virus. So as we talk about when we're talking about cleaning in the house also, and this applies to your hands, but regular soap and water is going to be your best. That is a great way to deal with any coronavirus that's in your home or on your hands is just soap and water. And the things I talked about before, you'll see wipes with active ingredients like alcohol and that are specifically labeled disinfectant wipes. Those are all good. But in terms of antibacterial wipes, that won't do anything special.
And we're going to talk in a little bit about some of those other high touch surfaces like remote controls and cell phones. People have a lot of questions about that. But we also know that people have a lot of questions, and rightly so, about food. And that's where Jim Rogers with his food expertise comes in. Jim, let's talk, kind of about grocery shopping, which we know a lot of people are finding it to be challenging these days. Stores might not be stocked properly. If you're waiting for food delivery, it may be taking several days, maybe even several weeks in some areas. But let's be optimistic, and one way or another, you actually got some food to bring into your house. Can you kind of walk us through some safety steps as to what people should do once they've completed that grocery shopping, either in person or had it maybe dropped off at their doorstep? Need to be wiping everything down, including the food itself?
Well, thanks, Elliot. One point I'd like to make is that so far we have no data or information that indicates that you can get coronavirus transferred from either food packaging, et cetera. And so the CDC considers food and the packaging as a low risk uh, uh, chance of transfer that to consumers. But if consumers are still concerned, there's a couple things they can do. First off, is that if they have brought their own shopping bags, for instance, in their cloth, we're advising them to wash them between each grocery store run. So you unpack your food, put it on the countertop, then take that bag and immediately put it in your dirty clothes and then wash it in hot soapy water in your washing machine. The second thing is that if you're again concerned that you may have something on the surface of your food items, you can wipe them with a disinfectant wipe. That's one option. Another option, and this goes for like carry out food too, you could transfer that food to a different container, one that you've already washed and have in your cupboard, so that then you could discard the original containers they came from. And then, as we always are advising, wash your hands, wash your hands, wash your hands.
And you kind of led into a question that we had that was submitted prior to our Facebook Live. This is from Netta, and it does have to do with takeout food. There, of course, a lot of people are sympathetic to restaurants. Many of them in many cities have had to close down. Some are still open for takeout or delivery. Is the general idea that you can pick up food or you can have food delivered? Is that still safe to do? And are there any special precautions we should be taking when it comes to those takeout meals?
Well, in some ways, because of the recommendation on social distancing, actually having food deliver or getting takeout food is better because it limits your exposure to the number of people that you might come across if you went to the grocery store. So yes, that is seen as one option for getting food into your household. Again, we can't say whether there's something on the outside covering or container. So again, you could, as soon as you bring your takeout food in, you could throw away the outside bag. You could transfer the food into your own containers again and get rid of those. If you're having food delivered, we're strongly suggesting that you limit the contact to the delivery person. So have it dropped off on your step. If you're going to tip, use the tipping mechanisms and the ordering apps that are available. And then again, bring the food into the home, throw away the outside wrapper, and then enjoy your food.
Great. Okay. Very good advice. Thank you so much. Now, we had talked also about those high touch surfaces, Lauren, and I'm thinking the things that I touch most often, probably just like you, my cell phone, right? My TV remote, like all of those devices that we know are just full of things that should be cleaned on a regular basis. And maybe we haven't done it before, but we definitely should be doing it now. And there might be some special techniques that we should use because these could be sensitive electronics. And we have a lot more of this information, by the way, on consumerreports.org. So if you're looking for specific advice for your device or your brand, you might want to check that out. But Lauren, just kind of generally speaking, what should we be thinking of with those electronic devices that we know carry a lot of germs?
Yeah, Elliot, I'm glad to talk about this because I know it's something I'm suddenly so conscious of how frequently I touch my phone. Because suddenly you're kind of thinking of what you might have on your hands if you. So the first thing to remember is just to go back to this again. The best thing you can do is make sure your hands are clean before you're touching these devices, your remote, your phone, all of these other sorts of things. But in terms of cleaning them, so we've got some advice from our tech team. You want to be sure you don't kind of submerge anything like your phone or even spray something at it because that could really get into the openings in your phone and damage it. So you do want to wipe them down. And it's the same things we were talking about that'll work at home in terms of a 70% isopropyl alcohol wipe. That's one of the best things that you can use. And that's one of the things Apple says you can use on an iPhone. You can also use a disinfectant wipe in both of these cases, a remote or a phone. But again, just be sure you're not spraying anything. And if you're in doubt, just kind of like look at what the manufacturer's advice is in terms of what's safe.
And it really is easy. I'll just share what following our own advice at Consumer Reports. I have one of these blue plastic cases on my phone. I snapped it off, just used soap and water, scrubbed it really well, sprayed it down with bleach, and then rinsed it off. And it took all of probably, I don't know, 2 minutes. But it felt better. You just feel that sense of satisfaction immediately, knowing that again you just took one step to help that along. So great
Right.
advice, Lauren. Thank you. Now, as we said, we're all being told to stay inside, but of course, in some ways, life does go on and we do have to get outside. Again, it might be to go to the store, perhaps it's going to a doctor's appointment, whatever the case may be on the limited time when we do have to leave. We certainly want to be safe when we head outside of our homes as well. And that will typically involve transportation. Perhaps if you live in a major city and you're lucky enough to walk somewhere or bike somewhere, those are options. But for a lot of Americans, it means traveling by car, by bus, perhaps by subway, train, or by plane. Lauren, you've done some research into all of this, and I know some of them you're really advising people not to do right now. And then the other means you kind of have some ways to make those safer. So talk about that first. I guess if you want to begin with planes, that's probably the easiest one, right?
Sure. Well, so this again, I'm not a doctor, but based on kind of a lot of what the experts we've spoken to have said, most people are really going to want to postpone plane trips right now. That's a pretty high risk situation because you can be sitting in close quarters with a lot of people for an extended period of time. So that's something you really want to avoid. So I think a lot of people are canceling plane trips now, and a lot of flights are being canceled because of that reduced demand. As you were saying, Elliot, obviously this is a great time to bike or to walk. If that's an option for you, you can be by yourself, not around other people if you do need to go to the doctor or the store or something really essential. And if you're taking a bus or a train because you must, and that's the only way to get where you're going, there are a few tips that can help. You can try to go at an off-peak time, a time when it's going to be emptier. I think you'll find a lot of these things are pretty empty right now, and that's good. They should be. And then you also just want to be careful again of all those surfaces that you might touch. So if you're touching something like a subway pole, you're going to want to sanitize your hands right after that. Wash your hands when you get to your destination. And this is a tip you've probably heard a lot, but try not to touch your face when you're out and about. It's very hard. We all the time, but as much as you can try not to touch your face, that's going to help you out because it's when you transfer the virus from your hand to kind of one of these places on your face like your mouth, your nose, your eyes. That's when you can get infected.
I will say, just speaking personally on like week 3 or 4 now of trying not to touch my face, I think I'm getting better at it. I know
Yeah.
it is hard, but if that thought becomes sort of top of mind, I think maybe you can kind of undo, in my case, 40 plus years of face touching. So we'll see. We'll see.
Yes. Mind over matter.
Yeah, exactly, exactly. And let's talk also about gas pumps and if people are using some of those shared bike services, or I know a lot of the electric scooter rentals have shut down over concerns with the virus. But if they're still operating, again, it's these kinds of shared surfaces. I guess most people would be using the gas pump. What do we advise there?
With the gas pump, it's again, the easiest thing to do is just to remember to sanitize your hands right after you use it, before you can touch your face, before you can touch the handle of your car door and potentially contaminate that and your steering wheel and your gear shift. So the best thing you can do is to sanitize your hands right after you use the gas pump. Some people advise, use a paper towel or something like that, or just something that limits contact. And a lot of the experts we speak to kind of say it's a little complicated to use gloves because you might, feel safe wearing gloves and then accidentally touch your face or contaminate your hands when you take off the gloves. So that's something you have to be very careful with if that's something you're thinking of doing.
And I want to bring Jim in for that in just a minute, but I do have a viewer question that came in on that idea of gloves. And I think it really involves two things. It's sort of number one, Lauren, what you talked about, gloves itself, but then she does, this is from Linda, by the way. So Linda, thank you for sending this in. She does specifically reference that they are leather gloves and she uses them kind of coronavirus or not. It sounds like she keeps them in the car because maybe she doesn't like the smell of the gas or the feel of it. And she uses it on the nozzle, on the hose, and the buttons, when you have to enter your credit card information. And we'll talk to Jim about the glove technique in just a minute. But how about the idea of leather? Does that offer any particular risks or benefits when it comes to this, Lauren?
This is again something we need a lot more data on, but in general, I wouldn't think that leather would be a good thing to use because you're really going to want something like plastic that you can throw away right after you use it before you contaminate anything else, or some kind of washable glove maybe where you could kind of throw it in the laundry like Jim was talking about with shopping bags. So a leather glove seems like you're maybe setting it up to kind of, get contaminated when you pump the gas and then maybe you touch your steering wheel and then suddenly you also have to wipe down your steering wheel. So that seems like it could be a tricky option.
It may give you a false sense of security when you really don't have it necessarily.
Yes, exactly right. You might scratch your nose, not remembering that, you used the gloves on the gas pump.
Sure. And Jim, I know before joining Consumer Reports, you had experience in a lab that had some very strict protocols when it comes to putting gloves on, and in particular, in this case, taking them off. And I think you want to show us kind of the proper way to do this if you are in fact going to wear gloves for an added level of safety.
Yes, Elliot. So I have common latex gloves. They're designed for one use only, so disposable. And the key is to get the gloves off so that you don't contaminate your hands, which we assume are not contaminated under the glove. So here's one way to do it. Assuming the glove is contaminated, you actually grab one hand and you grab it at the palm and you actually remove the glove down your fingers. And then for the second hand, you use your index finger, you go up under the gloves, pressing into your wrist until you can hook that glove. And then you pull it above your hand. And then you have a nice, easy way to throw into the trash. You've not contaminated your hands. And then once you dispose of these into the trash can, wash your hands again.
That's a great demonstration that I've never seen before. Jim, thank you. And I'm sure I live in New York City. I see a lot of people walking around town with latex gloves on, and I doubt many of them are taking that extra level of care when taking them off. That's great. Thank you so much.
That's one of the reasons that's a tricky thing because not everyone has Jim's perfect technique in terms of taking them off. So
That's exactly right.
Couple years of training in that. But there
right.
are YouTube videos out there too. So
good to know. Good to know. And again, I just want to remind folks, if they're just joining us, this is Consumer Reports Live, staying safe through coronavirus. Lauren Friedman, our deputy health editor, and Jim Rogers, who leads our food safety and testing, is with us. And Jim, we will stick with you since you have that food expertise that we're looking for. Grocery shopping, as we mentioned before, has really been causing a lot of people some anxieties in terms of access to food, the availability of it, and then getting it home the safest way. When you're inside the grocery store, if you can't get a delivery or maybe it's not available in the area where you live, give us a sense of just some basic safe measures inside the store that people should be taking.
Okay, Elliot. The first thing I would like to mention to consumers is that as we stand now, there's not a food shortage. There's just issues in the logistics of actually getting the food to the stores. So one thing to do is to, number one, you could call the store and see when do they get their food shipments in. That will increase your chances of having what you're going to the store for. Second thing is that we are still want you to practice social distancing. So that means usually going to the store either when they first open or toward the end of the day. Now, if you wait till the evening hours, they may have run out what you were going there for anyway. But especially for those high risk groups, people that are older, have medical conditions, there are some stores that are actually allowing those groups to enter the store early or first, and then let the regular customers come in. So those are a couple of ways. The second thing is that once you get in there, bring your own wipes to wipe down your carts, because I've been in stores where they've actually run out of the wipes, so I've had to use my own. And then as you're shopping, practice social distancing. So if you go to the produce section and you want a cantaloupe, but there's someone standing there getting one, wait your turn away from there and then come back and then get the cantaloupe. So respect that 6 foot distance that's been advocated. Once you finish shopping, again, social distancing, keep yourself 6 feet away at least from people that you may be standing in line to check out. Use credit cards, not paper money or coin money to pay for your groceries. Bring your own pen to sign the receipt, and even use a pen to punch the buttons in the credit card machine if you need to. Again, as we mentioned, if you use your own cloth grocery bags to transport your groceries home, make sure you wash them once you get home. And then again, once you get home, wash your hands after you put your groceries away.
Great. Thank you. Good advice there. I will tell you the grocery store that I shopped at over the weekend in New York City felt a bit more like a nightclub with the bouncer, like a one in, one out policy. There was a 50-person limit, and it's actually a fairly large store. It's a 2-level store. And then they had very strict social distancing, 6 feet at the checkout line. So certain markets are certainly taking that very, very seriously. So good advice. And if your market does not have that enforcement, you can certainly try to practice it yourself. So thank you. And we had mentioned deliveries. Certainly a lot of us are ordering more from online merchants, Amazon, Walmart, Target, or grocery deliveries. A lot of those come through the mail. A lot of them come in cardboard or paper packaging. Lauren, what do we know about how long the virus can last or live on those surfaces? And should we take any special precautions with those boxes or packages?
So there has been some research on this that shows that the virus can last on cardboard, for example, for up to 24 hours, which sounds really scary, but keep in mind that it does degrade over time. And the CDC, for example, still considers the mail a very low risk route of transmission. They don't think that that's kind of a key way that the coronavirus is spreading. But because we know it does live on surfaces for quite a while, potentially, it is a good idea maybe after you go through your mail, just wash your hands. You're home, you've got access to a sink and soap. So it can't hurt to kind of take these sorts of precautions.
Great. And then just the last one on kind of these common surfaces that we all encounter when we're out of our own home, or maybe if you live in a larger building, you encounter these every day in your own home, stairs, handrails, elevators, again, things that we probably didn't think much about as being shared surfaces just a few weeks ago, but now we do. All right, welcome back to CR Live, staying safe through coronavirus. We hope you were able to join us for the first 30 minutes of our conversation this afternoon. As we perhaps alluded to, or maybe even promised at the outset, there might be some technical problems. So much of the world is now online, working from home or gathering information at home. Certainly the internet has probably never been taxed as much as it has been over the past few days and past few weeks. So we appreciate your patience with us. We have adjusted our stream to a lower bandwidth. Hopefully that will make this clear, and that if you had any buffering issues, those have been resolved. We can't promise that, but we certainly hope that is the case. Let me just quickly take the time to introduce our guest from Consumer Reports, Lauren Friedman, our Deputy Health Editor, and Jim Rogers. Jim, you have a long title. I always feel like I should refer down to it. Jim is the Director of Food Safety, Testing, and Research. I think I left out the research part of that the last time. I apologize. That research is very important. We appreciate what you do, particularly when it comes to your insight into coronavirus. So thank you both very much with that. We're going to pick back up here on something that is kind of the underlying thing that we've heard from public health officials really from day one when we began this big public awareness push to alert people of how they could, or what they could do to avoid contracting and spreading coronavirus, and that is hand washing. So we have a question here from Donna, and she's asking specifically about what kinds of soap you should be using to kill the virus. It sounds like she is kind of wondering if natural soaps, homemade soaps, basically the non-antibacterial soaps, will they work? Are all soaps created equal? Lauren, I know you're shaking your head there. Tell us what we need to know about soap, hand washing, and getting rid of the virus.
Okay, so soap is definitely your friend when it comes to getting rid of the coronavirus. There are certain viruses that are very, very hard to kill that kind of require some special treatment. And this coronavirus is not one of those viruses based on everything we've learned so far. And soap actually works very well because it's what's called an enveloped virus. So it has a layer around it that is sort of easily broken apart by soap. And soap is very effective, and antibacterial soap is really not necessary and doesn't give you any sort of added protection because that's designed to fight against bacteria. And this is a virus. And even with bacteria, regular soap does a pretty good job. The important thing, and you've probably gotten sick of hearing this, but you want to wash your hands thoroughly and well. So that's for at least 20 seconds. There are a lot of different songs you can sing that people are talking about to make sure you can bide that time correctly. But yeah, scrub your hands for 20 seconds and then rinse them off. And whatever kind of soap you're using will probably have done a good job as long as you kind of rub them together, go between your fingers, the backs of your hands. Don't forget your fingertips, and you should be fine no matter what kind of soap you're using.
And we know that a lot of people have been looking at hand sanitizers, even though Consumer Reports and most public health experts recommend hand washing first and using hand sanitizers as a backup. If you can't find the Purells and the other kind of name brand hand sanitizers, can you go a different route? Can you make your own? Can you go a natural route? Or is there really no substitution for the ingredients that are inside a commercially available hand sanitizing product?
So in general, you don't really want to go a DIY chemistry route with this. That's what the experts we've spoken to have said. Jim might also have some thoughts on this, but it's not so easy to hold together. You can kind of put the right ingredients together and shake it up, but it might separate, and then you won't. Basically, the important thing is you want that hand sanitizer to be 60% alcohol at a minimum. And if it's not kind of mixed correctly, then the amount that you squeeze out onto your hand might not have the appropriate concentration of alcohol. So that's one of the reasons commercial hand sanitizer is better. And we know it's hard to find right now. And that's why there's so much emphasis on washing hands, because even though you can only do that when you have access to a sink, at least, soap does not seem to be in short supply. So do wash your hands as quickly as you can. And if you can get your hands on some commercial hand sanitizer, that's a good thing to take with you as a backup.
And Jim Rogers, another component to this question.
Yeah, Elliot.
I was just going to add one thing to the question.
Well, I just wanted to note that.
Go ahead.
Well, I just want to note, Elliot, is that there have been reports of people making their own hand sanitizer. It was being and it burned people. Other ones to caution people not to try to make up their own hand sanitizers to prevent any adverse reactions that may happen from these homemade concoctions.
All right, Jim, you were breaking up a little bit on my end, but I think it was a caution about people potentially getting some chemical burns or otherwise having some injuries related to that sort of chemistry project that Lauren alluded to when it comes to hand sanitizers. Let's move on because, yesterday here in the Northeast, it was a really miserable, almost winter-like day, and what a difference 24 hours makes. The sun is out, the birds are chirping, the grass is green, and pretty soon allergy season will be here. It may already be in full bloom depending on where you live. And some of those allergy symptoms might mimic or mask coronavirus symptoms or vice versa. So we're going to actually talk about what you need to be on the lookout for to kind of identify the early symptoms, and then what you should do if in fact you think you might have COVID-19. So Lauren, will begin with the disclaimer that neither you nor Jim are doctors. You are not medically trained, so you're not replacing a physician, but you can kind of walk us through, because we do have several weeks, months of reporting on this now. What are some of the kind of common coronavirus symptoms, the incubation period, that people might be on the lookout for, or might want to differentiate between allergy season as it is arriving in many parts of the United States?
Right. So a lot of these symptoms, as you're alluding to, can mimic some symptoms of other things, especially something like the flu. But the most common symptoms that we see in the research related to coronavirus are a fever and a cough. That's kind of the most common, a fever and often a dry cough. Fatigue is very common. Some people have muscle aches, some trouble breathing, like tightness in the chest, or getting out of breath easily. Um, there are some scattered reports recently you may have seen in the news that some people lose their sense of smell, but it's not yet clear if that's a common symptom. But that fever and dry cough, those are kind of the things that we hear from physicians and researchers are two of the hallmark signs. And it doesn't show up that way in everybody, but those are two of the most common symptoms that people have at the beginning.
And when would they begin to show? Let's say, I later learned that I was near someone that had tested positive. What's kind of the safe period of time there that I might be on the lookout?
Yeah, so generally what's called the incubation period, the time the virus can kind of develop into potentially showing symptoms, is generally considered about 14 days, which is why you keep seeing that time period as how long people are quarantined for, like after they've come off a ship or been on one of those flights that happened at the beginning, or even if they've been exposed to someone. 14 days is generally that period, but most people actually develop symptoms more quickly. It's kind of more common to develop symptoms in about 4 to 5 days. But yeah, 14 days is considered the window, although there may, of course, be exceptions.
Sure. And we actually have another question here, and this is a great one. I think a lot of people are wondering about this. This comes from Richard in Denver. Richard, thanks for submitting this. He asked that he initially heard that if you contract the virus and recover, you are then immune going forward. And now he's hearing that this is a unique virus and it's not the case. So he wants to know what's going on here. If you test positive, contract COVID-19, are you sort of then good to go? Do you have that term herd immunity that people might have heard about, or is that not the case?
This is a great question. It's something that scientists are also trying to figure out. Unfortunately, we don't know yet if people who are sick with COVID-19 develop an immunity to the new coronavirus that will last long term. We can't really know that until a period of time has passed. Basically, we don't know how long people's immunity will last. And what you may have heard this term herd immunity. That basically means that enough people have developed immunity, whether that's through a vaccine, which doesn't exist yet, or through developing immunity by getting sick, that the virus can no longer circulate. So we're certainly a long way away from that, but we don't even know yet if an individual who gets sick develops long-term immunity yet. That's definitely a good question, though, because it's something we really would like to know.
And I guess the underpinnings of this question are also kind of the idea of the questions of, will the virus decrease in warmer months and then will it resurface in colder months? And I suspect the answer is the same. We just don't know yet. Is that correct?
Yeah, that's correct. There have been some reports suggesting one way or another, but it's really too soon to say. We don't really know what's going to happen in the future regards to weather.
Okay. And Jim, it appears as though you're kind of back on my end, so feel free to jump in here. I had lost you a little bit with some bad internet. You're back, you're looking clear, you're looking good, so feel free to jump in here. The idea now of what to do and what not to do, and there is a lot of confusion out there, and again, it might depend on where you live, how overtaxed your local doctor's office is, perhaps your urgent care, perhaps your ER. Lauren, do you want to offer some general advice if you're coming down with these symptoms, if you want to get tested? And again, this may change day to day, region to region, but generally speaking, what should people do?
Yeah, so again, I'll just reiterate what you said at the beginning, that I'm not a doctor. So if you have questions about your own symptoms, talk to your healthcare provider. But in terms of some general guidelines, the number one thing you don't want to do is just show up to your ER because you think you might have COVID-19, because the risk there is if you do have it, you risk exposing everybody else to it. And if you don't have it, you risk picking it up yourself. So that's just a general don't do. And it's the same for your doctor's office or an urgent care. If you just kind of walk in without taking any precautions, you really risk exposing other people or being exposed yourself. So the general thing we've heard from doctors we've spoken to is that it's very important to call ahead. Kind of if you do want to go see your doctor, which may be a reasonable thing to do depending on your symptoms and your background, like your age, just call ahead, let them know you think you might have it, let them know why. They can talk about your symptoms symptoms. And if you do come in, they'll probably take certain precautions, like they might take you in through a side door or keep you away from other patients. They might put a mask on you. And this is also a great opportunity to try some telemedicine services you might have heard about that you haven't had an opportunity to use before. Some people have that through their doctor's office. You also might have access to that through your insurer, and that lets you talk to a doctor or nurse on the phone or through a video call without having to go into an office. So with mild symptoms, if you're kind of a low risk person, those are some good options to start with.
I was just grabbing my phone. We have Aetna as our health insurance at Consumer Reports. I have the Aetna app, and I don't know if this is visible or not, but right on the home screen of the Aetna app, it says coronavirus, we're here to help. And you can start a video visit right there from the home screen. And it is a zero copay from something called Teledoc. So I think that will be one of the kind of interesting trends, I think, to watch post-coronavirus as we get through this. What does telemedicine look like, and how valuable a tool was it for people that thought they had symptoms? You know, could they get the help they were hoping for through remote access? I think that'll be interesting to see in the months ahead.
And if I could just add one thing I want to be sure to say, which is that if it is an emergency, like if you or someone you live with is having a lot of trouble breathing or something like that, those are cases where you do not want to hesitate to seek care. Just because this is a contagious new virus, if someone is really in distress, you should call 911 and you should tell them, you know, I think this might be COVID-19, so that they can be appropriately cautious. But of course, you should seek care when it's really needed.
Of course, very good. And then we've heard something about people that are asymptomatic, and I guess that's always the challenge. If you're not presenting with anything, how do you know? But you want to kind of like walk us through that, and what that looks like, and kind of the impact that might have on other people around them?
Yeah, this is something that's come up with this new coronavirus, is that there are several reports that suggest that people can be infected with the virus, not develop symptoms, but still they're able potentially to transmit the virus to others. And really the important thing about that is just that is why it's so important that everyone follows the advice of public health authorities, that even if you feel fine, even if you don't think you're sick, you should still stay home, because there's still a chance that you could have the virus, you know, without even knowing that you do, and transmit it to someone else who could get very ill.
Great. And question about testing. Again, it varies widely, but do you want to offer kind of some high-level observations on where we stand with testing right now?
Yeah, so as you said, Elliot, you know, it really does vary. Different states, different cities, different counties have different sorts of access to testing right now. But in general, the first step, again, is going to be to call your doctor. They'll probably have the latest from your local health authority, and they'll be able to advise whether or not you can get a test. Sometimes testing is only available for people who develop severe symptoms or for people who are admitted to the hospital. Other times they might be testing available for people in more high-risk groups, like people who might have heart disease or diabetes, or be in one of the older age groups that are at a higher risk for developing severe symptoms. So unfortunately, it varies too much for us to offer kind of specific advice to everyone today. But yeah, the first good step is to check with your doctor. And in some cases, you can call your local health department if you think you might qualify for a test.
And Jim, if you can hear me, and I think maybe you can now, you were mentioning before
Yes, I
we,
can.
great, but before we started that your daughter is actually on the front lines of some testing in New Orleans. Is that right?
Yes, she's actually down in New Orleans, and she works for a hospital down there. And she was recently given all the PPE, or personal protective equipment, to actually man a drive-through testing facility. So she's down there taking patient information, swabbing throats and cheeks, and submitting these swabs for testing.
And certainly in the New York area, you know, we have seen several of these sites pop up. There's one in northern New Jersey in Bergen County that has been at capacity every day that it's been open. But that also, Lauren, you and I were talking about this, that also could indicate why numbers in the New York metropolitan area are so much higher, because there does appear to be more testing taking place here than perhaps other parts of the country. And we've heard this for several weeks now. The more you test, the more likely you are to see your numbers go up.
Right, that's true. And we were also talking about how we've seen the numbers in New York go up, but it's also true that at this point in New York, they're actually discouraging people from seeking out testing. As long as they have symptoms, they can manage at home, because really the message has been stay home, that, if you have symptoms, it's riskier to go out, and it's riskier for the healthcare workers who then need protective equipment to test you rather than the protective equipment they'll need to treat patients. Although, of course, that also varies from place to place.
Sure. Final question on this, then we promise to end with some upbeat notes, so we're not all left with this feeling of doom and gloom. If you happen to be living with someone who has COVID-19, we know it is a highly contagious virus. It would seem that would put you at higher risk, obviously, of getting it yourself. Are there any things you can do to sort of minimize that, Lauren?
Yeah, so you're right that it's kind of spread within a household is some of the most common spread that we see of this virus. The CDC has pretty straightforward guidance on this, which is basically that if someone in your house is sick, even if they don't have kind of a confirmed case of COVID-19, since as we were just talking about, it can be difficult for some people to access testing, you should basically proceed as if they do, as a precaution. And the basic advice from the CDC is that someone should be isolated in a separate room. Ideally, they would have access to their own bathroom if that's possible with your living situation. And that's when you really want to be vigilant about cleaning any of those shared surfaces, doorknobs, countertops, tables all throughout your home, and also just to kind of minimize contact between people in the household. If you have a mask, that's actually a time you want the person who's sick to wear a mask. That'll help prevent them from spreading what they're sick with to the other people in the house. You can also try to not share things like dishes, just to be extra safe, but really physical distance as much as possible is key here, along with just kind of keeping those shared surfaces clean.
This might be a good time to bring in one question that we had, and it's kind of a variation of what we heard. I think the question was kind of relating to, can the virus live on cleaning cloths if you're using those? But this brings up the idea perhaps of laundry. And I don't think we've done any particular unique reporting on laundry yet, but Jim or Lauren, either one of you can jump in here, kind of based on what we know of previous best practices when it comes to getting rid of things like viruses, bacteria, germs. Any advice that you could give people that might just be wondering, what do I do with my cleaning cloths? What do I do if my partner or a family member, how do I wash their towels, their sleeping clothes, things like that?
Yeah, I can jump in on that. Yeah, the
I
CDC
would
again.
strongly.
Go ahead, Lauren. Jim, we'll come to you in just a second. Go ahead, Jim. Lauren, excuse me.
Oh, okay, sure. Yeah. So again, the CDC does have some advice on this, that even though we don't know everything about this yet, the general advice is to wash with laundry soap, that most regular detergent, as we were talking about with regular soap. There are a lot of similar qualities. That regular detergent will work just fine. And to wash it basically at the warmest setting that you can without ruining your clothes. That's actually what the CDC says, that kind of wash it at the warmest setting available for your particular clothing item. But of course, if you want to be safer, dry and wash at a higher heat. But the soap is the important part there.
Great. And Jim, did you want to add to that?
Yeah, I mean, Lauren is right. Most viruses, or all viruses, are susceptible to heat. So by washing your clothes in the hottest hot water setting with soap and drying them at a hot setting, you should take care of those viruses pretty well.
Terrific. Great. All right, as I mentioned, it is a gorgeous day here in the New York City area, hopefully, or potentially where you live as well, although some rain is moving in. So I assume if you are west of New York, perhaps you're experiencing that rain today that we will get here tomorrow. But let's talk about getting outside. It has certainly been something that we have been hearing a lot about, because people are being told to stay inside. And yet we all know that there is some level of getting outside that is good for the mind, and certainly good for physical activity as well. So let's just start with the basics, Lauren. What can I do outside? What shouldn't I do outside? And what are some best practices if I decide to head out?
So as long as it's allowed kind of where you live, getting outside is a great thing to do. It's one of the few things you kind of can do, as long as you can keep a distance from other people. Again, you want to remember that 6-foot distance is kind of the safe distance. And that's just because that's generally considered how far droplets can travel when people cough or sneeze, which is, one of the main ways that this virus can spread. But yeah, you should get outside. You should enjoy nature. You should check to make sure that kind of parks in your neighborhood or in your state are open. Some parks have closed. We've seen some hiking trails, and that's mainly a crowd control measure, that if there are places where they think people won't be able to practice social distancing, they might start to shut those down. So just check, but that is one thing you should do. We encourage you to get exercise, get outside, get some sunshine if you can. There are some places where people who are more high risk should probably really stay indoors just as a precaution. But if you can get outdoors, that's a great thing to do.
And we know the kids are at home too. Schools are closed, daycares are closed. Parents may be tempted to go to a playground. Do you have any precautions there, or is that good to go?
That's probably one of the things you'd want to avoid as a precaution, just because, first of all, there are often lots of different kids on the playground, and there are a lot of shared surfaces. So you run into all the issues we were talking about before with shared surfaces, that people who may cough into their hand or who touch their face and then touch something like playground equipment, that can kind of help spread the virus. That said, if you have a swing set in your backyard, you're good to go. That's good, as long as your kids don't need to share it with anyone.
And of course, there are other activities you can do inside your home. There are yoga. There are some apps. I resurrected. I mean, I'm almost embarrassed. This is an 8-pound weight, which is funny. I don't know if you can see that. This is. I
No
may not
shame.
be. Oh, right, right. Well, I'll take whatever I can get. But I did notice that in the lobby of my building yesterday, there were several boxes of people buying fitness equipment. At home barbells, things like that. Because I think people are under the realization that their normal activities, if it's going to the gym, maybe it's a group exercise class, maybe it's group sport, those are probably going to be off limits for several weeks, maybe several months. So, I think we have written about them, and there are some really creative ways that you can still stay in shape, both mentally and physically, and technology can help with that, perhaps more than it ever did in the past.
Definitely. Yeah, you're seeing a lot of gyms offering online fitness classes. There already were online fitness classes. So this might be a great time to look into that if you're someone who's used to going to a gym, or even if, you're just going a little stir crazy in your house. There are even some free kind of guided exercise, meditation, yoga that you can try online with the appropriate precautions. Kind of, don't try something crazy and new on your own, but definitely it's a good time to try some things at home, and even some basic things like you were talking about, Elliot, like hand weights that you might have, jumping jacks, push-ups, stretches. These are all good things that you can do on your own at home to kind of stay in shape and stay healthy and try to stay upbeat during what's a difficult time for everyone.
Exactly. And part of that also in staying upbeat, I think, can be helping others. We had to say goodbye to Jim Rogers. We were having some bandwidth issues with Jim, and his signal was dropping out. But if Jim was still here with us, I think he would have offered some anecdotes about something. There's Jim right now. But Jim, I'll let you hear my question. This was perfect timing. Thanks for coming back in. When we're getting to the part about kind of our mental spirit, and part of that can be helping others, and the way technology can help. And I believe you have some experience with an app called the Nextdoor app. Tell people what that is, and who they might be able to help if they use that app in their neighborhood.
Yes, the Nextdoor app is one that my family and I have subscribed to, where it is basically a way to link up with your neighbors electronically. You can share information, you can share your Ring doorbell videos, you can sell stuff on Nextdoor. But in response to the coronavirus pandemic, Nextdoor added a feature where you can offer to help your neighbors. So there are a number of older neighbors in my area that may not be able to get out, may not be able to get to the grocery store, may not know how to use technology to order food online. And so I have placed myself as someone who's willing to go shopping for anyone who cannot get to the store. And I would act just like a Peapod or any other delivery service. I would go purchase the food and just leave it on their doorstep. And so that's a way to actually outreach and to help people that may be more affected by this pandemic than I am. And I'm glad that they made that the option, and gave me an opportunity to be able to serve my community.
That's a very nice way to end, and we will wrap it up right there. And we'll thank you for being such an upstanding member there, Jim, too. Thank you so much. I should just, on a personal note, just reflect on how grateful that I am for the expertise of these two folks and so many other people at Consumer Reports who have been working, I think tirelessly might be an understatement, over the past few weeks as we have been trying to learn and report with you in many ways in real time on what is probably the health issue of our time, at least for right now. So we are very, very grateful that these folks have shared an hour with us this afternoon and taking the time to prepare for this Facebook Live event. It will be archived on Facebook and perhaps some other social media channels on Consumer Reports throughout. Give us some time to post it up there, but you'll be able to watch this if you missed any of it. So Jim Rogers, our Director of Food Safety, Testing, and Research, and Lauren Friedman, our Deputy Health Editor, who's coordinating all of our coronavirus coverage. Again, I can't thank you enough, not only for your time today and this afternoon, but for what you are doing to keep consumers informed through this very, very challenging situation. And thanks everyone for joining us out there. We really do appreciate you being here. We know we had a lot of people join us. We know we had a lot of questions that came in. Due to some limited time and bandwidth issues, we obviously couldn't get to all of them, but our social media team will do its best to respond individually. But do please check out all of Consumer Reports resources. We have made it easy for you to do that. The website, cr.org/COVID-19, cr.org/COVID-19. It is your guide to all of Consumer Reports coronavirus coverage from the very first story that we did, which was probably weeks ago at this point now. And we are updating that obviously every day with new content that we hope will get you and your family through. Most of all, we do want to say thank you. Be well, stay well. These are challenging times. Consumer Reports will be here with you. Thank you again.
Thank you, Ellen.